Why are we here? We are here today because I have a question. Do you want to die? Most of you would say no. I would say no if you ask me if I want to die. But what if I ask you, do you know why that person is homeless? Do you know why that person is on drugs or alcohol? Right? What if I ask you, do you know why? Most of us would say we don't know why. Here's why. Most of the people that you see on drugs and alcohol and who are addicted to drugs and alcohol is due to some kind of childhood trauma. Maybe they were raped. Maybe they were molested. There's various reasons. But most of the time, people are addicted to drugs and alcohol due to some childhood trauma because they didn't go get the help that they need. Some of us didn't even know that we needed help. Some of us didn't even think that we had a problem. Me, myself, I am a former substance abuse user. And it took me a lot of years to figure I needed help and I was tired. But as I educated myself, I learned that I had to surrender. I learned that I had to go and talk to somebody. And that's why I'm here to talk to you. Because today we're going to talk about substance use, the effects and the behaviors and how it affects a life overall. And how many people have died today, or maybe yesterday, or maybe over a year. A lot of people are losing their lives daily due to lack of education, right? But I want to talk about this in particular doctor that done some amazing work and research on why we end up this way. Now, Dr. Volkow, a female, she's an amazing doctor, has been instrumental in demonstrating that drug addiction is a brain disorder. As a research psychiatrist, Dr. Volkow pioneered the use of the brain imaging to investigate how substance use affects brain functions. In particular, her studies have documented how change in the dopamine systems affect functions of brain regions with reward, right? Maybe that's why I kept using, because I kept feeling good. It makes you feel good, but it also affects self-control and addiction. She also made important contributions to neurology, obesity, ADHD, and aging. Now, all that plays a role into what I'm saying, because you have people that are obesity, they have an eating disorder, but it's all connected. You understand? Now that that's out the way, we're going to move on to alcohol. Now, I'm going to break this down because many of us may not have known, and I have known at all until now. When you drink alcohol, your brain releases dopamine, a transmitter linked to pleasure and reward. The rush of dopamine is what contributes to the initial euphoric feeling associated with alcohol consumption. By increasing the effects of GABA, responses in the brain are decreased. This slows the nervous system, results in slurred speech and blackouts and hangovers. In some cases, death can happen. So maybe that's why when you at that party, when you out there drinking, you don't remember what happened because you done blacked out. Because sometimes the dopamine rush is so strong, right? It blacks you out. You may think you're feeling good, but really you setting yourself up for failure. Now listen, there's another doctor by the name of Dr. George F. He said this: he has done a study. He's done a study on some rats, and this is what he found out. He said, if you ever seen a rat press a lever 100 times per minute to stimulate its metal forebrain bundle, that part of the brain that generates pleasure sensation, that's what has them hooked. He also said, I like to say that I spent the first half of his career studying why we feel good, and the second half of his career trying to understand why we feel bad. And that, he says, it became interested in alcohol and other drugs of addiction and how it affects the brain, right? Alcohol is a lubricant, believe it or not. Wow, blew me away as well. It is used widely in the United States. Now, y'all know it's a lubricant because when you fall, you get hurt, what they put on you, alcohol. Even though we always ask for peroxide, but they never listen. They give us the alcohol. But did you know it is used widely in the United States? Around 70% of Americans drink alcohol one time or another. And this is from the CDC as well. CDC says it is used widely in the United States. Around 70% of Americans drink alcohol one time or another. But what people don't realize is that having more than one or two drinks, depending on one's individual circumstances, can produce basic toxic effects. Yeah, even one drink a day can increase a woman's risk of breast cancer, according to the CDC. That's real. Now, what I'm giving you is statistics and numbers. I'm not here to play games with you. I'm not here to make you want to believe what I'm saying. I'm telling you what the CDC says. You can take it for face value. The CDC also says excessive alcohol use is responsible for about 178,000 deaths in the United States each year, with a significant increase in deaths from 2016 to 2017. All the way up to 2020 and 2021. This is all CDC. CDC. Yeah. Now, I'm going to give y'all a more detailed breakdown. It's all CDC. Overall impact, excessive alcohol use contributes to the substantial number of deaths annually in the United States. Annually. So that means every year. About 178 deaths occur annually from excessive alcohol use. This number represents a 29.3% increase from 2016 to 2020 to 2021. The average annual of deaths from excessive alcohol use amongst male increased by 26.8% from 2016 to 2017 to 2020 and 2021. Deaths from excessive alcohol use increased from 34.1% amongst the females from 2016 to 2017 to 2020 to 2021, which means that women are consuming more alcohol, and there's a possibility women are the ones are high in those deaths. Truth be told, alcohol is not good. Alcohol will destroy your life and possibly end it in different ways. For me, I never came home for weeks. I drank. I wound up in hospitals. I wound up in accidents, 3 DUIs. Life was hard. Life was hard. But guess what? It's so dangerous out here. Truth be told, a big gap between the scientific alcohol and the public understanding about alcohol, and even healthcare professionals can't even put a number on it, or even about the disorder, because we're still learning about it. Because there are new controlled substances coming out almost every year that is hard to trace or keep up, because every time they turn around, we have to do more research on a new drug that done came out. So, with that being said, we never know a specific number. We never know. Now, we're going to get down, because according to the FCC, which means the Federal Commissioner, the Federal Communication Commissioner, the opioid, because now that we're done with alcohol, we're going to move on to opioid and the crisis here in America. The opioid crisis has been ravaging communities and families across America's states for the past decade. In 2017, the opioid crisis was declared a public health emergency under Section 319 of the Public Health Service Act. That was the declaration was renewed most recently in June 2024. The crisis claims more than 220 lives per day. Evidence also suggests that the impacts of the opioid crisis have been accelerated during the COVID-19 public health emergency, with significant increase in alcohol and substance misuse and worsening mental health. Recent research, however, suggests that the use of telehealth services and medication for opioid use disorder was associated with reduced risk for fatal overdose. During the COVID pandemic, the telehealth was associated with an increase of likelihood of staying in treatment for opioid use disorder, which is a good thing because it gives us direct contact with health providers who can help us, Now, according to the Centers of Disease Control and Prevention, more than 645,000 people have died since the opioid crisis had started. There were approximately 81,806 opioid overdose deaths in 2022. 81,000. And that number goes up, continues to go up, right? For right now. And that's sad because a lot of people really don't understand like what's going on. Now, there were nearly 290,000 emergency department visits related to opioid use and poisoning, accidental overdose. So I hope you know, and I hope you are learning from this information and also the sources that I've gathered the information from. In closing, now this is the closing. And in closing, now that we have reached the point of this presentation, now we can do a recap. Now, we talked about alcohol and how many lives it has taken away per year. And number two, we have talked about opioids, how addictive they are, and how it was more used during the COVID crisis of 2019, as well as over 645,000 people have to come to death due to accidental overdose. So I hope you learned something. This is my presentation. Thanks for listening. You guys have a blessed day.